Welcome. This is a series of short video clips about injury surveillance data in North Carolina. This series has been developed by the State Advisory Council, SAC, Injury Data Goal Team. Today's topic is navigating to find injury violence data specific to North Carolina. So if you're at your desk and you're wanting to try to find information on injury and violence, the best thing to do is look into Google, and I'll just open up a website. If you go to www.google.com, if your search is injury data North Carolina, one of the first things that you'll come to in many cases is the North Carolina Injury and Violence Prevention Branch homepage. In the event that your Google search doesn't lead you to this, the website is www.injuryfree.ncdhhs.gov. From the homepage, there's a couple of different places that you want to look to try to find injury data. One of the first places is the Data and Surveillance page. So if you click that particular link, it will open you to a page that has a lot of injury and violence surveillance. The top portion of this page has several different surveillance systems, so BRFSS, which is the Behavioral Risk Factor Surveillance System, CHAMP, which is the Child Health Assessment and Monitoring Program, YRBS, which is the Youth Risk Behavior Survey, PRAMS, which is the Pregnancy Risk Assessment and Monitoring System, and NC Detect. All of these systems, by and large, are, at least the top 3 or 4, are survey systems in which people are asked about various questions about their health. So the RFSS asks adults in North Carolina about several different health indicators, including injury and violence. CHAMP is a subset of the BRFSS. They call back parents of people who've been surveyed for BRFSS and ask them about their child health. The CHAMP survey has multiple questions on injury and violence. The YRPS has lots of different questions around suicide, drinking, illicit drug use, and prescription drug-based for non-medical purposes. Talks about violence, in particular physical assaults. Talks about carrying weapons, things of that nature. NC Detect is the state system for tracking. It's a syndromic surveillance system for tracking emergency department data across the state, of which about 20 to 25% is trauma or injury related. Now, if you're just trying to find some basic specific data around injury and violence, there's several little buttons down at the bottom here that we'll talk through quickly. So if you're looking for the leading causes of injury, death, hospitalization, or emergency department data, if you click there, it will open up a secondary kind of page. Here you have data from 2007 to 2009, all ages, the top 5 causes of injury, death, hospitalization, and ED visit by county. So that is specifically county level information. We have it by all ages, 0 to 14, 15 to 34, 35 to 64, and ages 65 and above. Below that is a series that was done before, which is 2004 to 2007. So it's basically the same data, just a little bit older. In the table, there are several death data charts. Here's one of the leading causes of death by age. Actually, this might be a table. This is a chart that has, even though it's really busy, it has a lot of information here. Across the top is age groups. So less than 1, 1 to 4, 6 to 9, or 5 to 9, 10 to 14, all the way to actually, in this case, 85 plus, and then all ages. These are specifically related to injury. So the blue, things that are coded blue are unintentional. The things coded red are intentional assaults. And the things that are green are self-inflicted. So you can see across the age spectrum, lots of unintentional injuries happen and occur in those age groups. This is the leading causes of injury, death. for all races, both sex by age group, and then you have the rankings of how things rank. So in this case, for the age group less than 1, unintentional suffocations, there were 16 in 2010. Motor vehicle unintentional, looks like there were just a handful. The third ranked is other class unspecified. It could be a combination of things. Here you have unspecified assault. So even in the lowest age group, assault is one of the things to keep in mind. Things that are grayed are undetermined. So there's kind of 4 categories of intent: unintentional, intentional assault, self-inflicted, and undetermined. Okay, so that's just this is part 1. We'll clearly need to do several different parts, but I wanted to kind of give you where the website was and how to kind of get into the first level of data. Please feel free to contact our office with any questions or concerns. If you have another data topic you'd like to see, please send us an email or like, subscribe, or comment on the YouTube channel. This is part 1 of a multi-part program. Thank you very much.